Breaking news! The immunity system has attacked cell citizens all over the body. Betrayal to our health. This is bad. Humans are bound to have SLE.
What is SLE?
To understand SLE, I'm going to pass to Liver Cell to explain the problem. Liver Cell, what is going on?
Yes, Brazil, I'm Liver Cell. So now I'm going to talk about what is SLE. SLE is an autoimmune disease. In this disease, the immune system mistakenly attacks its own healthy cell. For example, kidney, liver, brain, and other organs. They are most likely to get caught by women. It usually happens to people around 15 to 45 years old. But after all, it is a genetic disease that are triggered by the environmental.
Thank you to Liver Cell for the explanation. Now, I'm Heart Cell going to talk about the history of SLE. SLE is an autoimmune disease that is first diagnosed globally in the 19th century. In Malaysia, early cases were diagnosed in 1917, but due to the limited medical knowledge, many cases were misdiagnosed. Thank you to by the 80s and 90s, advancement in medical research improved treatment and diagnosis. The Malaysian Society of Rheumatology and Persatuan SLE Malaysia played key role in 2000s. More hospital and research center focus on autoimmune disease studies, leading to the better treatment and early diagnosis. Today, treatment of SLE has improved a lot, but many people still don't know enough about it. While Malaysia has improved in managing SLE patients, ongoing research and education still remain crucial. So, what causes SLE and how it affects our body? Let's find.
Hi, I'm a reporter from Skin Cell. So now we are going to know what is symptom and causes of kidney, lung, and joint failure due to SLE. First, the symptom of kidney failure is the patient will have swelling at leg, feet, and around their eyes. They will have foamy urine and potentially have blood in their urine. It causes when lupus autoantibody affect part of kidney that filter out their waste from their body. Because of that, their kidney will swelling and have irritation that called inflammation. Next, the symptom of lung failure is the patient will have shortness of breath, chest pain, and cough. It causes is when the patient have inflammation of the pleura, which is lining of the lung, and when their blood clot travel to the lung and block their pulmonary arteries. Lastly, symptom of joint failure is stiffness, swelling, and joint pain. It causes is when body immune system attacking their own tissue, and also when patient have a vascular necrosis, which is lack of blood supply. Now, I will pass to the reporter Kidney Cell.
There are a few precautions that you can take so that you can avoid the development of SLE. Firstly, you should avoid environmental pollutants because environmental pollutants can lead to the stimulation of immune cells, which can furthermore develop the SLE disorder. Secondly, you have to engage in frequent physical activities that are appropriate for your body. This is because physical activities can reduce oxidative stress, and oxidative stress is really bad for your body because it can lead to the worsening of lupus itself. Thirdly, you should monitor the intake of your medicine. This can be done by taking medicine as prescribed by your doctors and not taking it excessively.
Thank you, Kidney Cell, for the updates of the precaution. Now, as Skin Cells mentioned, there are a few types of diseases that has been caused by SLE, and the treatment for SLE are different based on the types of diseases that humans have caught. For example, if humans have caught kidney failure disease, then the treatment would be dialysis, which can help filter waste and also access fluid from blood. If humans have caught lung disease, then the treatment would be antibiotics for bacterial inflammation, pain reliever such as NSAIDs, and also potentially draining excess fluid. And lastly, if humans have caught arthritis, then the medical option would be medication, physical therapy, and in some cases, surgery. For example, if humans have caught kidney failure disease, then the treatment would be dialysis, which can help. This concludes the news for today. I'm Brain Cell. Stay safe and stay alert. Good days to all Cell citizens.